Have you ever thought about if you should find a lump on your breast? What you should do? Most of the time they say regularly go and have a breast exam done with your doctor, regularly have a mammogram. But what if you can't afford it? What if it's something that is not within your reach? If you're in a rural area, or if your local clinic doesn't allow it, or if you can't sit for hours at a public hospital waiting to have a mammogram done. Also, the dates that they give you for a mammogram is like, I mean, if there's a lump, you might end up having a mastectomy before you have a mammogram. But how do you check on your own to make sure that you are always in good standing in terms of your breasts? But let me explain to you how you do a breast exam if all else is not within your reach. So first of all, you're going to stand in front of a mirror with your hands beside your hips. And when you look into the mirror, you're going to look at both your breasts. You're going to look if your nipples are both in the same place, if one boob might be sagging lower than the other, if the whole anatomical view is symmetrical. That's the first sign. Then you're going to lift your hands up and check for the same thing. If when your hands are up, are your nipples still in the same place? Is the symmetry the same? Are they both where they need to be? And then the next thing you're going to look for is, most of the time when you're moving your hands or your breasts, your nipples will secrete discharge. If you do have a discharge and you're not somebody who's breastfeeding, then that could be a problem. The next thing you'll do is lie down on a flat surface or on your bed. Put your hand behind your head, and you can either use the palm of your hand or you can use your fingertips. So you're going to start at your collarbone and you're going to apply pressure in an almost circular motion all the way around from your collarbone right to where your cleavage starts. Then you're going to start again on the top part again, feel all the way back down to your cleavage, and then just feel around the rest of your breast. You could do this lying down, as some people prefer doing it standing up. It really doesn't matter. Either way, hand up and apply pressure in a circular motion to find if there are any lumps. If you are breastfeeding, chances are that the symmetry won't be the same. So you shouldn't stress, but you still have to obviously check. If you are on your period, chances are you might feel something that feels like a lump, but probably isn't. So it's advisable not to check for any lumps on your period. Why is it important to check for these lumps? Because if you find it, the best thing to do is to consult your gynae or your GP immediately, so that further investigation and testing and treatment can be done. This is very important, and it's important for girls as young as from the time they start developing breasts to women well into their 60s, 70s, 80s. Breast cancer doesn't discriminate against age, so it's always important to check. You can leave a comment and we can chat about it. But for now, thanks.